Hi, it's Tom here from Running Physio. Marathon season is upon us. We've got lots of marathons coming up this spring, so I thought I'd record a video for you with some top tips on treating marathon runners that you see in clinic. Now, it is a particular challenge working with marathon runners. They often come to us with pain, but also they're needing to build up their mileage in preparation for one of the most challenging events in endurance sport. So they're trying to do more when their body's actually maybe telling them that they need to be doing a little bit less. So we need to work out, how do we actually navigate this? How do we guide them up to the marathon itself? How do we manage the symptoms? So that's what we're going to talk about in this video today. Also, I've put a link to our running resource page where we've got a great selection of free videos for you that you can check out if you want to learn more about running injury. So first up then, the first top tip is we need to know what the marathon involves, particularly the training for the marathon. If you know and understand the preparation, then you can guide someone through it really successfully. And I think there's probably four main phases I would consider in the marathon preparation itself. So let's have a look at those phases and what we're looking at in each one. So first of all, most marathon training programs, you're looking at a roughly 16-week program. Now, it's going to take this time to build the person up to where they want to be. So the four phases I would usually consider is, firstly, we have a build phase that we've highlighted here in yellow. Now, this is where we're focusing on mainly building up that long run, building up the training volume. Second phase is going to be peak mileage. This is where we're going to hit long runs, typically between 18 and maybe up to 22, even 23 miles. So it's good to know this. This is what someone needs to build towards. They need to reach a point where their body can manage, 20 plus miles, hopefully, during this peak phase. Then we have a taper, as we've highlighted here in green. Now, this is really important. The training volume reduces significantly during the taper, and hopefully you can see from the kind of example guideline we've got here on this image, it's going to reduce significantly pre-race to address fatigue. Now, sometimes then we can get someone to peak mileage and we can use that taper to help settle down their symptoms. And then finally, the fourth phase, probably the most important phase for the runners, is the race itself. 26.2 miles, and they often say it's two races, one to reach mile 20 and another one to do the last 6 and a bit. And I would agree with that personally. Having done marathons, that last kind of section is particularly challenging them. So let's have a look at some tips for each of these phases then. Now, during the build phase, we really want to make sure we're building training volume here. It's an endurance event, so it's got to be volume that's the priority. Higher level athletes might focus on speed as well, but it's very difficult to get around a marathon if you've not got those miles in your training. So I would focus on training volume and prioritize long run distance. So if you're working with a runner and they're struggling with their running, it's that long run that we're going to really make important. That might mean that we sacrifice a run or two in the week if necessary, if that helps them get through that long run and gradually build up towards their peak mileage. Also, during the building phase, we tend to use a recovery week roughly every 4th week to address fatigue. So you can hopefully see the long run distance mapped out on the chart here, starting at 8 and building to 10, 12, etc. And you'll see roughly every 4th week, we've got a down week where we're going to reduce by maybe 10 to 20%, something like that, to allow fatigue to settle, to address any symptoms. So we plan that recovery in there. Don't wait until someone's really struggling. Another tip for the building phase is you can replace or top up runs with cross training during this phase if they're limited by pain. So as we say, maybe you replace a midweek run with some cross training on a bike, on a rower, in the gym, in the swimming pool, whatever works for that runner. But what we're looking for here is pain-free cross training, so we can get the fitness benefits without the pain that they might be getting through running. Now, this sort of top-up approach can be quite useful, which you can do based on time. So let's say they were aiming to do a 90-minute long run, but they can only manage 60 at the minute. You might do 60 minutes of running and top up to 90 by adding 30 minutes of cross training. Plus, in this phase, we may want to include rehab and strength work, but just be mindful of fatigue. In the early parts of this build phase, the first 5 to 6 weeks of a marathon where the training volume is less, this may be a better time to build strength work. As their training volume's increasing and they're doing more, they are going to get fatigued. So just bear in mind, if we bring in a big, complex, demanding strength program, they're going to struggle to fit that in. So that's some of the thoughts and tips for the building phase. During peak mileage, here we want to try and help them manage symptoms and fatigue at this point. Again, the long run is usually the priority. So I think if it's helpful for them, yes, use hands-on treatments, use things like your massage, your taping, use strategies that help settle their pain so we can get them through this phase. And then once they're through it, then they've got the taper. And often lots of aches and pains will reduce during the taper, as will fatigue. Now in that taper phase then, fatigue and symptom reduction is key. So less is more. Now lots of runners, when they've been doing a lot of training in the preparation for this, will feel kind of restless, like they want to do more, like they want to train more during this taper period. You can't get much fitter when you've only got a couple of weeks left prior to a marathon, but what you can do is get more fatigued and you can irritate any existing symptoms. So less is more. I would tend to focus on more recovery, less mileage during this time, particularly less training volume to address fatigue. And then finally, final phase, we've got race phase. Having a plan for the race phase is really important for people. So having a rough idea about what training pace they're going to be using, but also if they've had symptoms during their training, having some strategies they can use on the race day to manage them. Things that you will have tested during the other phases. So they've been using these things during the build-up phase, maybe during their peak mileage and tapering. So it might be a warm-up technique that helps to settle down some tightness for them. It might be a particular shoe selection which feels more comfortable for them in terms of symptoms. It might be some gait re-education cues they can use that have been effective to reduce their symptoms as well. It might be a taping technique, some orthoses, but some things that you've tried in advance, because race day is not the time to start bringing in new things for them to try. Anything you want to use in race day should ideally have been tested well in advance. Now, I know this myself from my own personal experience. I had one of my last marathons, particularly busy time with work, struggled to fit the training in, struggled to test things in advance, and decided to test out a different fueling strategy on race day, something I'd never tried before. It really didn't go very well. Got lots of muscular cramps because my body just wasn't used to it. So don't test new things on race day. It's time for the tried and tested stuff, even down to the things people eat prior to the event, the timings of things like that. Use it all well in advance. So first tip here is know the marathon and modify the training around what the person's able to do. Very, very important. The second tip is identify the priority at each stage. So think about what is the priority now for this individual that I'm seeing in clinic. Is it pain? Are they coming to you at a point where they're irritable, they've got pain with day-to-day activities like walking, going up and down the stairs, and really the priority is settling those symptoms down, in which case we'll often need an offload period where we might stop running or back off a bit with the running to a manageable level, maybe replace with cross-training as we've said. And here is where our calming strategy is going to be so important. Perhaps some hands-on stuff to settle things down, taping techniques and things, etc. Whatever we can show that actually reduces this patient's pain. So the focus is on settling symptoms, settling irritability as a priority. Now, at other points, actually, the priority may be fitness and race prep, particularly during that building phase. We do need to try and build that mileage up. So if symptoms have settled and they're non-irritable, the focus may be more on training more, particularly pushing the training volume and the long run. At other points, particularly in taper, fatigue is the priority. So it becomes more about reducing fatigue, particularly around reducing the training during taper or a point where they're very fatigued, maybe using a recovery week, but also optimizing recovery, particularly sleep. You know, I often tell people taper is a great time to bank as much sleep as possible. Think about your nutrition, address and manage fatigue. Now, if you feel fatigue is the priority, and the patient's telling you they're very tired, they're tight, they're achy, you may be testing them and finding their strength scores are lower because they're fatigued, this is not a great time to add in more work. So I won't be adding in more challenging strength work during the taper period or at a point where they're very fatigued, because the priority is addressing that fatigue. And finally, some points it might be that strength and rehab needs are more of the priority. Perhaps earlier on in this training program, when the training volume is less, you've identified a key strength deficit. So we're going to focus on having that strength work in there regularly 2 or 3 times a week. And perhaps later in the marathon training program, as the volume really increases, we're going to reduce that training down to a level that's a bit more manageable, maybe once a week as a kind of maintenance dose, really. So a couple of kind of top tips with some extra ones thrown in there. So know the event, identify the priority at each stage for the person that you're working with. Then we want to find what's manageable for them in terms of their training and build from there. Subjectively, this is where our assessment's so important. So we're trying to find out what's a manageable amount of running that doesn't lead to a lasting flare-up of their symptoms. And then we're going to build from there towards their goal, whatever their peak run mileage is, using the time available. And often with this, it's not necessarily about 10% rules or anything like that, but it's looking, how much time have we got to build you up towards the distance you want to get to. If we need to build you up by 10 miles and we've got 10 weeks, it's very simple. We're going to add a mile a week. And that's often what it will come down to working with your marathon runners. Now, inherently, training for any event, especially if you've got pain, there is some risk involved. So the next tip is to discuss risk with the patient and help them make informed choices. If they're going to be pushing up their training towards these goals, the main risk is they're going to flare up their symptoms. Now, we know for the majority of people, running is not damaging for their body, but there might be some situations where you've got perhaps a bone stress injury, where there may be risk of more complicated things developing. So we want to discuss that with them. If they're happy to proceed and push their training, knowing that the risks might involve flaring up their symptoms or having an injury that takes a bit more time to settle, fine. But we want to help them make that informed choice. Lots of runners will take that risk if it's an important event for them, but some of them will say, actually, do you know what? I'm going to leave this one. I'm going to not worry about this marathon. I've got another one coming up in a few months' time. I'm going to focus on my rehab. I'm going to take the pressure off myself, and I'm going to focus on that event in the future. And sometimes that can be sensible to do when actually, we talked about this, what is the priority, here. If actually you're identifying multiple issues for them to work through. So they both got pain and irritable symptoms, but they're also not race ready at all. They haven't built their long run distance up at all, and they simply don't have enough time. Perhaps they've also got strength and rehab needs as well. And in that situation, when they've got pain, they haven't got adequate fitness, they're not going to be race ready, it may be more sensible to say, okay, let's bail out of this one and do another event further down the line. Okay, so find that manageable start point, build from there, discuss the risks with them, help them make informed choices. And also, next tip would be keep the rehab short and simple. If you're listening into this and you've trained for a marathon, you know how hard work it is, particularly if you've got challenging goals. You might be training 5, 6, 7 times a week potentially. Most of us do it alongside full-time work and childcare and all those other things that we've got to do. It becomes incredibly difficult if you put in a very complex, time-consuming rehab program for them. So I would prioritize and have a maximum of 3 exercises for someone. I would often do them in a short circuit of maybe 15 minutes. So you're doing 3 exercises in that circuit, relatively low reps. So we might be looking at 3 sets of 8 to 10 rather than doing very high rep, 3 sets of 15 to 20, etc. So it's short exercise program. We can go quite heavy in that to develop strength. We may even want it so that it's challenging for them to complete those 10 reps, each time they're doing them. But we don't want to be doing huge complex programs. Short and sweet will work quite well. Now, usually we'll keep these on the days that someone's not running wherever possible, so they're not trying to run on tired legs. So 5th tip here is keep the rehab short and simple, and think about how you can modify it through those training phases. As we said, as we're getting towards peak mileage and taper, it may be more appropriate just to have a once a week strength training session, and during a building phase, doing a little bit more to build that strength up. Now, final point here, we've talked a little bit about this already, is hands-on stuff is fine. I think it actually does have a role quite often, particularly in those final weeks prior to a race. I see so many runners coming to see me 2 or 3 days prior to a marathon with a really tight calf, or a sore ITB or something similar, where we just don't have time to do load management, to do strength and conditioning, to do all the things we talked about. Now, in that situation, I think it's, as long as it's safe to do so, as long as you're not identifying a serious pathology in your assessments, I think it is reasonable to use some hands-on treatment, to calm symptoms down, to look at strategies to help them get through that race. Quite often people have invested months and lots of time and energy. They've sacrificed a lot for these events. So if we can do something to help make that more comfortable for them, I think it's perfectly reasonable to do so. So this is a situation where hands-on stuff to reduce pain is actually quite useful, but an important part of this is we don't want to rely entirely on that. We need to make sure, particularly in the earlier stages of the training process for a marathon, that we're looking at those other needs around load management, around strength and conditioning, around fatigue management, and we're preparing them for the race. I think a lot of people will, end up coming in and seeing someone and getting a massage once a week for a long part of their marathon training program, but unless their needs are being addressed, we're not going to get the results, and actually quite often they're going to struggle to complete that event. So a few tips there to think about if we run through them. So the first one was know the marathon and the training involved. The second one was identify the priority for each stage. The third one was find what's manageable and build from there. Fourth was discuss risks with the patients to help them make informed choices. Number 5 was keep rehab short and simple. And then number 6 was by all means include hands-on stuff, but don't rely entirely on it. Now let's wrap this up by talking about an example then that we've seen in clinic, and we'll come back to these training phases then. So we've got here, like we had in the earlier pictures, the long run distance that you can see mapped out across the training weeks that are along the bottom of the graph. So what we've got here is you can see starting on the left at week 1, this run has built up from 8 miles to 10 miles, and then is starting to get some pain weeks 2 to 4, some knee pain. So at this point it's quite irritable, so the priority for us is addressing pain. So the next phase we've highlighted in a bit of kind of a purple color here. Then the next 3 weeks, we've gone for an offload period based on what's manageable. So this runner said, I'm pretty comfortable up to about 6 miles, but as I go beyond that, the knee starts to become sore. So we've said, okay, let's do a couple of weeks at 6 miles for your long run, and then let's see if we can start to gradually build you up. Also during this offload period, because their training volume is less, we've started to introduce their rehab exercises, their strength work 3 times a week to try and address some of their rehab needs. Now 3 weeks down the line, because we've offloaded, maybe we've used some hands-on stuff, some taping to make things more comfortable, we can now start to build again. So this yellow block goes back into a building phase, because if we've got to get them ready for this marathon, at some point we've got to do that. So we've built them up then, gone to 8 miles, 10, 12, and on to 14 over the next 4 weeks to build them up. Now we know we've got peak training mileage coming up on the horizon. You can see highlighted in blue here. So we've gone for a recovery week. We've dropped down by about 40% to a 10-mile long run, allowing them then hopefully to have a bit more energy in the legs so they can then push on again to reach that peak mileage. Now you might see here that what we've done is, because of this offload week, We've pushed the peak mileage later into the training program, and we've shortened the taper. And this is often what we have to do, is look for ways to get someone to where they want to be. Find what's manageable, as we've talked about, and gradually find a way of building them up to where they want to be. We've reduced the peak long run distance as well. We've said, let's go for 20 miles for the long run. That's more realistic to reach in the time frame. Then we've got a short taper that you can see highlighted in green, and we've got them ready for the race day. So hopefully you can see there an example, particularly just really focusing on the long run, as we did in the earlier diagrams as well, because that's often the priority. But we can modify things, get them through that painful flare-up, and then gradually build them to where they want to be. Okay, I hope that's been helpful for you. If you're working with a marathon runner perhaps at the moment and you feel a bit stuck, or you've got some questions, do let me know in the comments and replies. Happy to help with those if you need kind of more specific suggestions and ideas. And as I said, if you want to learn more about running injury, we put a link to our running resource page. We've got a great video on iliotibial band syndrome there, for example, that you can look through. Lots of extra resources there, so do check that out. And if you're doing a marathon yourself this season, best of luck. I hope it all goes well for you. Okay, take care. Bye for now.